Pump disconnect video. Here is a list of supplies that will be used for the disconnect. These supplies are provided to you by your infusion room nurse. Disconnect supply kit contains the following: a pair of chemotherapy protective gloves, 2 10 ml syringes of normal saline, 1 3 ml syringe of heparin, gauze pad, medical tape, Band-Aids, and alcohol wipes, cap for the end of the chemotherapy pump, a urine cup for port needle, chemotherapy safe bag, and a disposable drape for keeping the area clean. First, check to make sure the pump is completely empty. When empty, the ball will be completely deflated. You must wash your hands with soap for 15 seconds and dry them with a paper towel. Remove syringes from their plastic packaging. Gently loosen the cap of the syringe. Without taking it off, press the plunger slightly to break the seal and remove the air from the syringe. Then retighten the cap. Repeat this with all syringes. Clamp the port tubing. At this time, put on the chemotherapy protective gloves that are provided in the chemotherapy safe bag your infusion room nurse gave you. Clamp the chemotherapy pump tubing. Remove the end of the chemotherapy pump tubing from the needleless connector at the end of the port tubing. Place the cap provided in the bag on the end of the chemotherapy pump tubing. Place the clamped off chemotherapy pump tubing and empty pump into the chemotherapy safe bag. Swab the end of the port tubing needleless connector with an alcohol swab for 15 seconds. Then let it air dry. Don't let the swabbed connector touch anything. Take off the cap from the saline flush. Twist the flush syringe onto the end of the needleless connector. Slowly press the plunger with a start and stop action to flush the saline into the port. Disconnect the empty syringe. Repeat for the second saline flush and heparin flush. Clamp the tubing after the heparin flush is empty. Now remove the dressing over the port needle and tubing. Put pressure on the faceplate of the needle, or the wings of the faceplate, with a finger on each wing. Then grasp the top of the needle with fingers from your other hand. Pull up and out until the needle comes out and clicks. Be sure you hear the click to make sure the needle is in the locked, safe position. Place a gauze pad over the needle hole and keep it in place until it stops bleeding. Put a Band-Aid over the site or tape gauze over the site. Place the port needle in the urine cup container provided in the disconnect kit. Remove your gloves and place in a disposable bag, along with the rest of the used supplies provided in the disconnect kit, and wash your hands. Return the disposable bag with all of the used supplies in it on your next visit.